Welcome to the audio overview of exercise and hypertension. Copyright of the following content belongs to Dr. George Panayiotou. So, we're going to dive into a pretty powerful idea today. What if one of the best treatments for high blood pressure wasn't something you get from a pharmacy, but something you already have in your power to do every single day? Let's get into it. All right, here's our game plan. First, we need to understand the enemy, right? What exactly is high blood pressure? Then we'll get to the good stuff, why exercise is such an amazing prescription. We'll even peek under the hood at the science of how it literally changes our bodies. After that, it's all about action. I'll walk you through a safe, practical blueprint to get started. And finally, we'll tackle the real secret sauce, how to make it all stick. So let's start at the beginning. High blood pressure, or hypertension. Why do they call it the silent condition? Well, because that's exactly what it is. You can feel totally fine, no red flags, no alarms going off, all while your heart and arteries are working way too hard under this constant invisible strain. It's a quiet stress that can do a lot of damage over time. Now, you might hear doctors talk about essential hypertension. That accounts for like 90% of all cases. Essential is just a fancy way of saying there isn't one single identifiable thing causing it. It's more like a mix of genetics, lifestyle, and your environment all playing a part. And the number that a lot of experts are looking at now as the starting line for high blood pressure, a consistent reading of 130/80. When you get your blood pressure taken, you always get two numbers, right? Think of it like this. The top number, systolic. That's the pressure when your heart is actively squeezing and pushing blood out. It's the peak force. The bottom number, diastolic, is the pressure that's still in your arteries even when your heart is resting between beats. One is the peak strain, the other is the constant strain. Both are super important. So what actually determines those two numbers? It's really a pretty simple equation. It's how much blood your heart is pumping out times how much resistance that blood meets in your vessels. So if your heart pumps harder, or if your vessels get narrower, what happens? The pressure has to go up. It's just basic physics happening inside you 24/7. Okay, so that's the problem. But let's talk about the solution, because this is where things get really exciting and honestly really empowering. We're now moving from the problem to the action plan, and one of the most powerful tools we have is movement. We're talking about exercise as a genuine, evidence-backed prescription. And look, the proof is absolutely everywhere. The best part? It's not about finding one perfect workout. The research is so clear on this. Running, lifting weights, cycling, even those short, intense HIIT workouts, they all move the needle in the right direction. As emphasized by Dr. George Panayiotou, the key is consistent movement, making it a non-negotiable part of your life. And this isn't just a small effect. We're talking an average drop of 8 points on that top number, the systolic pressure. Now, 8 points might not sound like a revolution, but in the medical world, that is a huge deal. That's often the same effect you'd get from a starting dose of blood pressure medication. Just let that sink in. A brisk walk can literally be as powerful as a pill. Now, here's something interesting. Depending on where you are in the world, the official definition of high blood pressure changes slightly. In the US, the guidelines from the ACC and AHA say it starts at 130/80, but in Europe and other places, they often use 140/90 as the cutoff. But here's the crucial part. While they might debate the exact number, they are in 100% agreement on the first move. The absolute first line of defense every single time: lifestyle changes. Okay, so we know it works, but how does it work? I mean, how can just moving your body change the physics inside your arteries? Well, it's not magic, it's biology. It's this amazing cascade of changes where your body literally starts to rewire itself for the better. Let's pop the hood and see what's going on. A big piece of the puzzle is a system in our body called the renin-angiotensin-aldosterone system, or RAAS for short. You can think of it as your body's internal thermostat for blood pressure. When this system is too active, it tightens your blood vessels and makes your body hold on to salt and water, a perfect storm for high blood pressure. Regular exercise basically acts like a dimmer switch, turning down the intensity of this whole system. And as emphasized by Dr. George Panayiotou, this is why being consistent is so important. It keeps that dimmer switch turned down long term. But that's not all it does, not even close. Exercise also makes the inner lining of your blood vessels healthier and more flexible, so they're less like stiff, rigid pipes and more like flexible hoses. It also calms down your fight or flight response, so you're not living in a constant state of low-level stress. Plus, it lowers inflammation throughout your body. It's like a complete system overhaul, all aimed at one thing: bringing that pressure down. All right, the science is solid. But knowing why it works is one thing, knowing what to do is another. So let's get practical. Let's build your blueprint for a safe and effective exercise plan, because just winging it isn't the best approach. We need to be smart about it. So, what does that right exercise plan even look like? Well, the key is to have some structure. And as emphasized by Dr. George Panayiotou, when you're dealing with hypertension, being smart and safe about how you exercise is absolutely paramount. The good news is we have a fantastic evidence-based framework to guide us. It's called the F.I.T.T. VP principle, and it's basically your ultimate cheat sheet. So F is for frequency, aim for aerobic or cardio on most days, and sprinkle in some resistance training 2 to 3 times a week. I is for intensity, keep it moderate. For cardio, a good rule of thumb is you can still talk, but you couldn't sing a song. T is for time, at least 30 minutes is the goal. The other T is for type, and this is the best part. Pick something you actually like. Walking, swimming, dancing, if it gets your heart rate up, it counts. And finally, V is for volume and P is for progression, which just means trying to do a little more over time as you get fitter. It's a simple, powerful formula. Now, this is really, really important. Safety comes first, always. Think of these as the golden rules. You've got to warm up and cool down, no skipping. When you're lifting weights, think smooth, controlled reps, not one giant maximum effort lift. And please, whatever you do, breathe. Holding your breath while you're straining can make your blood pressure spike dangerously. And of course, listen to your body. If you're not feeling well, take a day off. It's that simple. And if you have any existing heart conditions, talk to your doctor first. That's non-negotiable. So we have the science, we have the blueprints, but let's be honest, the best plan in the world doesn't mean a thing if it just stays on a piece of paper. This brings us to what might be the hardest and most important part of the puzzle. How do you actually make it a habit that sticks? And if you ever feel your motivation starting to slip, just remember this. This isn't just some friendly advice from a health blog. We're talking about the biggest, most respected medical institutions in the world, all saying the exact same thing. This is a critical intervention. Your commitment to this lifestyle change is a powerful form of medicine. And remember, exercise is powerful, but it's not a magic bullet that works in isolation. It works best as part of a team. When you combine it with a healthy diet, cut back on the salt, and manage your weight, look at that stat. Losing just a bit of weight can drop your pressure by as much as 20 points. It all works together. Each good habit you build makes all the others even more effective. So it really all comes down to this one last question, and it's a question for you. We've seen the evidence, we've broken down the science, and we've laid out the blueprint. So what's the one thing holding you back from starting? And more importantly, what's one small thing you can do to overcome that barrier today? Don't worry about perfection. Just focus on that first step, because that's where all these life-changing benefits begin.